Know that.
You are on.
Okay, well, welcome. We'd like to welcome you to another edition of our webinar. We'll try this evening to answer some questions about laser eye surgery. Tonight I'm joined by Dr. Endel, one of the three practicing partners of our business. And what we're going to do first is to kind of give you a little bit of housekeeping rules. We do have a chat box that you'll see on your screen. If you have a question, if you type in a question, we'll try and get to all of them. Last time we didn't quite answer all the questions. We also have other ways to get into the practice in terms of information gathering. You can call us at 800-309-2020. You can do info@fichte.com, or Erin Edson, who's our refractive surgery coordinator. If you call and ask to speak to her or leave her a message, she'll also answer questions for you. So there's a lot of questions that come up almost every single time, so I'm going to address some of those. But just by way of introduction, Dr. Endel's been with us now 15, 16 years, and started at a practice down in Louisiana where they actually did some of the first refractive procedures on eyes anywhere in the whole U.S. So done tons of cases. He and I have been working together for many years. I've been here 26 years, working surgery with all three docs. So what I want to first start out with is I'm going to have Dr. Endel address a question that was at the end of our last webinar that was really important that three different people asked and we'd answer. Basically, address the question that everybody has on their mind. How long does this procedure last? Is it forever? Does it wear off? Or what can happen? Kind of a short answer, but go ahead.
Sure. So we're referring to LASIK, and LASIK is laser treatment to that clear dome on the front of your eye called the cornea. There's other surgeries we do on the inside of the eye, and there's so many lasers in ophthalmology for different treatments like your eye pressure and back of the eye that can get confusing. What we're discussing tonight is LASIK surgery. Right around the age of 18 to 20, the front part of your eye stops changing shape. Dr. Fichte has performed this procedure on all three of his sons, and two of them at age 17 and one of them at age 18. And they're all in their 30s now and never have needed a touch-up. What we know from over 20 years of follow-up by the FDA and peer-reviewed studies, that since the advent of this on humans in the mid to late 80s, it does not wear off.
Good.
So we expect it to be a one-time procedure. About 4% of folks in our hands might need an enhancement or a touch-up, but that's almost always within the first 6 to 12 months. So it's not going to sort of surprise you 4 years later and wear off. It's going to work, and it's going to keep working.
Awesome. We just saw that we have a question from a gentleman named Frank. He wants to know if we use a blade or if we use laser, and I'm sure he's questioning about how we make flaps for LASIK. So talk a little bit about both blades and laser making flaps, please.
Sure. So again, even to take a step back from there, because not everybody's probably an expert in laser surgery, so we're talking about that clear dome on the front of your eye called the cornea. If you think of it of like a 500-page phone book, the very surface is all the sensitive cells. So if we can create a flap, or almost like your own little contact lens on a hinge, if we can bring up some of the first 100 pages of that phone book, laser the permanent part of your cornea by evaporating all of your glasses prescription, and put that flap back down, as it turns out, within a couple hours, some of the scratchiness is gone. And by the next morning, most people can legally drive and be quite functional. That's LASIK surgery. From the surface, for some folks that don't have enough room to do that, works just as well, but takes a couple weeks longer to fully settle in. So now there's two ways to create that flap. One with no blades and all laser. You know, it's funny, a few years ago, we used to have our ad campaign that said LASIK for chickens. People heard the word blade and eyeball, and they say, well, yeah, maybe I don't want to do that. Well, thankfully, all of my family members and this guy had the laser when it first came out.
Yep.
And had the blade because that's all that was there. And you know, if you went out, the VCR used to work pretty well. But now we have options where the laser creating the flap is just that much more reproducible. We have two different lasers that create the flap. Of all of the
one's behind us.
In fact, one's behind us. That was the very first one in the United States made by Bausch & Lomb, that we were fortunate enough to be the first ones to use it for laser cataract inside the eye and LASIK on the surface. So we primarily create the flap with a laser, and what that does, it allows more people to be candidates that were before, because we're more precise and we know if you're going to be fitting within ranges where we said, well, I don't know if it's going to have enough room behind. Well, now we know how much room is going to be left behind. It induces less dry eye, and it allows for bigger or smaller treatments. It makes us look smarter because it does the procedure virtually before we step on the pedal and say, okay, let's let it go. Versus imagine if you're using the blade, which is quite safe, it's creating the flap, and where it cuts is where it cuts.
Question comes up all the time. I see now too. They ask about LASIK in sports, and honestly, we've done laser, not just LASIK, but we've done laser on a number of sports figures that have given us actual permission to use their names. For instance, Marshawn Lynch from the now Seahawks, but when he was here as a Buffalo Bill. But talk a little bit about, can you have LASIK if you play sports, or should you not have LASIK? Kind of a brief question answer about that.
Sure. So I said one of the indications to do the surface treatment, the no flap procedure, where the laser just starts from the front, feels a little more scratchy for a couple of days. But ultimately, when you get to 6 weeks out and beyond, the vision, the experience, the quality is identical, because the laser that's reshaping your eye doesn't know if it's doing it under this nice little flap we created or doing it right from the surface. It's still your own optical fingerprint, your own custom treatment. So the surface treatment is simply more available to certain people that can't have LASIK. Some people that are, say, in mixed martial arts or know they're going to take repeated potential shots to the eye will choose not to have the flap procedure, because the worry is within the first few weeks to months, if that flap wasn't fully sealed down, could it move when it was hit? Well, the truth of the matter is we've treated an awful lot of linebackers, an awful lot of boxers with LASIK procedure, and the physicians feel that it's quite safe to have done. Now, if you needed to start wrestling and boxing within 2 weeks of it, that might be a little premature. But the NFL players do it all the time, and it's a personal comfort. We would go over that with you at your 2-hour examination when we give you a recommendation is what's safest for you. But most folks, for almost any sport, could have either.
And just so you know, again, by attending tonight's webinar, you do get a credit for this. So if you decide to go forward and you book an evaluation, they do take off of the overall cost of this $50 per eye, just like you attended a brick and mortar open house that we have once a month, where you actually come in the building and watch this being done. And you're also welcome to do that at any time. But if you decide from the webinar tonight, please, we extend to you a $50 off per eye for attending this webinar, even though you're home. The other question that always comes up, because it sounds like some voodoo magic, is astigmatism. I mean, astigmatism, we've taken out billboards, we've educated just even primary doctors and just doctors in general. Astigmatism sounds like some horrible disease, but talk a little bit about astigmatism, how we fix it.
Sure, Ken.
Thank you.
Astigmatism is really taking the front shape of your eye and saying that none of us are quite born perfect. Most people have some degree of astigmatism, which simply means a little ovalness or a little oval shape to the front portion of the eye. If you correct that at the exact angle that is oval for you, with glasses, you see a bit better. If you have a certain degree of it, you may need a specialty contact lens, a toric contact lens, and if you notice, those have a little weight in there because they don't want the contact to spin around. It has to stay at that one orientation. If you take your glasses that fix astigmatism and you turn them a bit, you can't see as well. Well, the wonderful thing of the laser is it takes this three-dimensional optical fingerprint map of your eye, and the two eyes can't be the same even in identical twins. And then it tracks you from upright to lying down. Unbeknownst to us, our eye may turn a little bit when we lie down. So it doesn't make a lot of sense to take these wonderful accurate measurements unless you're going to perfectly superimpose it on the patient's treatment. So now we can treat astigmatism better than ever before, better than glasses and contacts, and this is not something that's easily let through by the FDA. The FDA has approved these lasers as the most accurate treatment for astigmatism. So not only can we treat it, we can treat it better than in the past and better than conventional glasses or contacts. And again, it does not wear off.
Talk a little bit about downtime. It's a question from Frank saying, can I have this done? How much time do I have to take off of work? So talk a little bit about how it interrupts your life a bit, but in the end, it's a lifetime thing you do for yourself. But talk about downtime.
So we talked a little bit about some of the procedures between with the flap, with LASIK, and the surface. So about 80% of people have the with the flap procedure in our practice, just because it's the quickest healing, it's the most comfortable, and if they're a candidate for both, for reasons we outlined before, it's what we lean towards as well. Most people that have LASIK can function to drive certainly daytime, maybe nighttime by the next day. So that gives you an idea of some independence and function you can do. And when I do surgeries inside the eye, separate from anything we're talking about tonight, more of cataract surgery or eye health issues, well, that's, even if it's a 2 millimeter little no-stitch incision, and you shouldn't bend and lift for a few days. But laser surgery on the surface Well, the Bills routinely tell me they work out the next day, and I believe them. They're pretty muscular guys.
Except this year.
So you can do a non-contact sport the next day if you wanted to go for a jog, lift some weights, that's fine. We prefer you don't do something like basketball, volleyball, where someone can get a finger in the eye for a week or two, a couple weeks on swimming for the bacteria. You can take a shower the next day. We prefer it when our patients
We do like it when you take a shower.
And, you know, the whole idea is just don't physically touch it. Now, as far as getting back to work, most folks like our Thursday and Friday afternoon laser sessions, which we've had every year for the last 20 years, because it allows them to get back to work almost routinely for most people on a Monday. So you maybe take a half a day. A lot of people will come working 3/4 of a day on Friday, come get the 4 or 5 o'clock position, go back to work, missing minimal work. If you have a very dusty environment, where you're constantly in chemicals and you're a bit worried, we're happy to support that with an excuse to maybe not to go back for a week, but that would be unusual, and that's about as long as you would almost ever need.
A question from Kate. She wonders about after procedure if she needs a ride home, and we recommend you do have a driver because A, you have some eye drops in your eyes, B, you're pretty blurry, and you really shouldn't drive yourself home. As well as the next day, you should have a driver for the next day, because on the checkup of day one, if there are any issues we have to address and need any further treatment, it's best if somebody drives you home. But talk about how safe it is, because yes, it's you have to have a driver, but whatever. But talk about the overall safety aspect of this, please.
Sure. Well, one of the main things people usually ask us at the open houses we've been doing is, well, does it hurt? How much does it cost? And is it safe? I mean, people say, oh my goodness, you're going to have a surgery on your eye. Well, that thing that's been around since, I guess, Leonardo da Vinci first drew it up for glass contact lenses are just quite commonplace. We don't think about the risk. A laser surgery, as far as risk of long-term decreased vision, depending on the papers you read, is at least 3, and some papers say 5 times safer than wearing contact lenses. Now, contact lenses are thankfully very safe, especially if you clean them and are responsible. Don't rinse them in your mouth and sleep in them and all the things that some things tell you can do, but you really should not. But you're taking something that is statistically the safest outpatient procedure you can have on your body, bar none. The risk of an infection is 1 in 10,000. We've actually never had an infection where someone's lost vision here, and we've done well over 40,000 procedures. But you can be the most advanced clinic with the best lasers and the best surgeons. If the patient doesn't take this procedure seriously and rubs their eye and sticks their hand in mud and does anything like that, you could get an infection. So much safer than contact lenses. It's going to last until you get some other aging change on the inside of the eye, like a cataract, which laser surgery doesn't make sooner or later. And as far as your downtime, again, we talk quite minimal. It'd be unusual to be down for more than a day or 2.
Stephanie says that she's been doing some research online, and she has read from numerous people that stay away from LASIK or stay away from eye procedure because probably for a lot of reasons it's not the safest thing. But we talked about safety, but true, a lot of people that look on the internet and research this, there's always 1 or 2 cases that could be horrific. We have never had that happen, but in the millions of these that have been done, when people don't follow the directions or they can get an eye infection, I mean, these things are possible, but we've never seen that. And as long as you follow the instructions, it's relatively safe.
And you look at the history of things that doctors have learned over time. There was a time in the mid-1990s where the area treated on that clear dome on the front of the eye was only about the size of your pupil or the biggest opening in that colored part of the eye. So at nighttime, some people's pupil was getting larger than the area treated. So during the day, their vision was perfect, but at nighttime, they tend to have more glare and halos. Well, now the customized optical fingerprint that we talked about will take a measurement in complete darkness with just infrared light. So we see how big your pupil can get, and then we treat a little larger than that. Now, everything in hindsight makes sense. So for the last 15 to 20 years, LASIK surgery has an 85% chance of helping you see better than your glasses or contacts. It used to be fun for us to try to tie that technology and just the convenience of not having to wear it. Now you have an 85% chance of doing better than your best vision of glasses and contacts. FDA numbers, not like a doctor's opinion. These are surveys that patients had filled out. When you have that combined with the 2-hour exam that you're going to have at a practice here that wants to make sure we do no harm first. We want to make sure that you're a good candidate. There's places and sometimes that have been a chain or a corporation where people have come in and gone out and the doctors are only there for a weekend, and I think wonderful intentions and wonderful staff, but without a lot of the checks and balances that you might have in an experienced center that's going to make sure that, well, maybe you're a patient that has such dry eye, I have to do different treatments before I do the procedure so that you don't heal slower. Or you have a slightly funny shape to the front of the eye, I can't cut a flap, but I can do the surface and get you just as good. It just may take a week or two longer to heal in. So there's no question it's a surgery. It needs to be respected as that, but that's what we take as serious as possible, and that's what we're going to look to customize your appointment for, so we avoid any of those pitfalls.
So just, I see a thing here from Bob. He wants to know how painful it is post-operatively. You know, and pain is relative. I mean, if you have a good tolerance for discomfort, then you probably won't feel anything at all. And it also depends on the type of procedure. Surface treatment, we've learned by experience through the use of cold packs and through the use of ibuprofen and chilled water right after the procedure, we really make you comfortable after the fact. LASIK generally, it's really not uncomfortable. It's a little bit of burning, scratching for maybe an hour after the procedure, but you know, it's manageable. And I can tell you from personal experience, having this guy do my eyes, that I actually did a lecture with him while we were doing my eyes, stayed around to put everything away, and as part of the lecture went out right after the procedure. So, you know, not to belittle it, but I wasn't in any pain. I mean, and I call people at night and they're not bad at all.
The LASIK procedure, it's so much, if you respect the procedure, a little anxiety, a little nervousness tells me that you're invested and you're going to pay attention to the directions. And what we see day in, day out, and it frankly makes our job fun while we're still doing this and playing with the wonderful technologies, the engineers that make us look smarter, is people come in nervous and there's just that sigh of relief when they're done. They go, that was it?
Yeah.
That was great. I could already see a little bit better. You do have underwater vision at night. There's no question it's not instant. You know, some of the reality shows might make you feel a little differently. You know, I do Botox as well, and you put that in. It takes 4 days to sort of relax the muscles. You put on one of the TV shows, they put the Botox in, and the person suddenly can't move their face. Now, none of those things are instant or work quite that fast, but it's pretty darn fast, relatively, especially when the larger script folks, you know, you don't understand that. I can't function without my glasses. So the first thing I do is grab that in the morning so I can even see the alarm clock or get up to go to the bathroom. These are things you don't think about until patients keep telling us all the freedoms they have when they don't have those glasses or contacts.
All right, let's talk about the white elephant in the room. There's not really a white elephant in the room, but everybody always wants to know how much does this cost. And we'll talk a little bit about the fact that there is a $150 evaluation fee. Some people don't charge for that. We feel that it's a necessary thing to do because you see a couple docs, a couple technicians, you have a lot of testing done, and that $150 is credited towards your procedure if you want to have it done, if you are a candidate. The big magic thing is, are you a candidate? And that's how we find out. But in essence, what are we talking about? I mean, for a pair of eyes to be done, the most technology that we have for all laser LASIK, talk a little bit about that, about costs.
So typically, if you have the appropriate thickness, the safe health to the eyes, that we're going to look at the maps that tells me about the shape of the cornea. We're going to dilate you, make sure the retina doesn't have early signs of diabetes, glaucoma, all of these things that are quite important because, again, do no harm first, make sure the eye health can handle it. If you have any of these conditions, you still may be a good candidate, but we may need to do a little medical tune-up first before you're allowed to be stable to have the procedure. So most folks will fit into what's the best chance and the safest way of being happy with your vision. Well, this is not only our opinion, but it's also the opinion of the Top Gun fighter pilots for the Navy and the NASA astronauts. And we have the only two lasers in Western New York that are approved by those two organizations. So if you can have an all laser customized treatment, I believe the current cost is $20.99 per eye, less than $2,100 per eye. That's as inexpensive as you can have those two technologies in the entire nation. There are different things that say, oh, well, what if I did it with a blade, or what if I did a non-customized procedure? You know, we actually offer some of those technologies, and we'll discuss them with you because a lot of people actually might be a candidate for them, and that might be a difference of $500 less per eye. And if it's just as safe because you don't have a lot of abnormalities and you have plenty of corneal thickness, it would be reasonable or we wouldn't offer it. But if you ask me, Doc, what's the best chance and the safest way to me have the best vision, it's going to be all laser LASIK because that's what the statistics have shown. That's what the government did, a meta-analysis of every laser that every doctor has access to. And these two lasers will do that for you.
Usually, well, we have a question about this, but usually people always want to know, well, can I watch this being done? And a couple things about that. you can see it on the internet, but sometimes it looks horrible when you watch it on there, because you know the narration is something that they're really talking about what's happening as it's happening, and the actual reality of it when you're on the table having it done, not bad at all. It's very rapid. It's very, it's like watching a ballet. It just kind of flows right through. During our webinars, we don't show a live procedure because it's kind of like a little fireside chat with the doc and I and all you. But once a month we do. If you want to come in to our regularly scheduled open houses on a Thursday evening, you come in, you go through a brief presentation. They talk about different kinds of eye procedures. You meet all three docs.
And a live patient.
And a live patient. And you get to see it. And the cool thing is the patient goes back there. They come out at the end and you ask questions, and you can, we don't tell them what to say, and we've been doing these for 15 years, and it's always been great. So yes, come in if you want to watch a live one. So.
Pretty important point I forgot to bring up that Kathy, one of our coordinators, would not be happy. The other thing about lasers, we know a lot of people don't have a lot of money burning a hole in their pocket. 2 years, 24 months, interest-free finance. So anything that starts to get in the realm of, less than a couple $100 a month with no interest starts to make it a lot more affordable, because we don't want, cash to be the only factor. And also, of course, you always ask our experts at the front, which is their job to help you decipher the fun of our insurances. Many insurances cover 15 to 20% of it, and that's certainly a nice chunk.
So just as a reminder, again, our web folk that are actually managing our webinar tonight just sent me a text message and said, please remind them of the offer. So again, if you decide from our webinar tonight to go forward on this, you just chime in and take credit that you were here, and it's $50 off per eye to come in. The other thing we also get a lot of questions are about our lasers, and it's always, us versus them, Pepsi versus Coke, who's better? And honestly, 4 lasers, 3 surgeons. We have a lot of choices here, but all the lasers that are made by FDA approval are good lasers. There's not a bad laser out there. There are some differences, so discuss our lasers. Why do we pick a Technolos laser? Why do we pick, a Vizx laser and our 2 femto lasers? Talk about the technology a little bit, please.
Well, for one portion of this procedure or not, there are about 6 different lasers that are FDA approved to do either the flap or the correction on the surface of the eye. And that's 2 different mechanisms. One simply evaporates tissue, originally used to etch computer chips by IBM, and they realized, boy, there's no heat here, and maybe this could be used for a biologic purpose. It's accurate enough to write your name in the side of a human hair. It kind of gives you an idea how smart some of these engineers are that make, again, we doctors look smarter. We have 4 lasers, 2 bubble flap makers, one that also can go inside the eye. So making the flap on the front of the eye with all lasers and no blades. And what does that entail? Well, it entails 18 seconds of feeling a little pressure, so the laser has a small suction ring to know where your eye is, about like a mildly firm handshake, just like this. And then you come off and you go, well, that was a little dark for a bit. That's it? Yeah, flap's made. And that's the most uncomfortable part. Because the second part, where the psychedelic purple light show is moving around, reshaping your eye, a little more here, a little less here, every nook and cranny that makes your eye uniquely its own shape, doesn't hurt even a little bit. It smells a little like burnt hair, which is a little gross, but we tell you going in, it's not your eyebrow on fire, it's not your eye at all. In fact, it has that same odor when the plastic calibration plate is underneath there. It's just the argon fluorine gas. So the lasers we chose are because of the research out. We know that an actual wavefront guided, not custom like, not wavefront like, but wavefront guided, actual custom optical fingerprint is simply the best chance of the least amount of glare and halos at nighttime and the best sharpness. Can I see the E, but can I see it sharply? My partner, Dr. Elmer, sometimes says, you go to the eye doctor and you have that what's better 1 or 2 test. And you get down to the bottom and you go, I don't know, they're about the same. Well, picture 6 more dials that say 2 is definitely better than 1. 3 is definitely better than 4. And that's what the customized lasers are able to do for you, get you much closer to them.
Well, this machine is kind of fantastic, and one of the most important things it does is it tracks you. I mean, your eye, as you're sitting there, your eyes are oscillating side to side. That's how you can tell movement. These lasers take a picture of your eye, and it follows you because your eyes are moving, and you get 100% of your treatment. The success of this before used to be 92% of 20/40 or better. The success has now jumped up to well over 98% of 20/40 or better because of those trackers. It makes us look like we're geniuses, but it's the technology that locks onto your eye. Same technology used to actually track satellites in the Persian Gulf War is applied to your eye. So it's wonderful technology. And it's not that other people don't have that technology available, but some take a true custom picture of the eye, as Dr. Endel said.
Some just use your
glasses prescription, or they use an average. So everybody that's the same prescription to you is treated the same. In here, your eye is your eye. It's unique to you, and it's the only eye like it in the whole world.
So that's the important distinction. So two people can have the exact same glasses prescription, and that's how all the other lasers that aren't true custom will treat you. And during the daytime, that works great, and they're very fast. But sometimes it gets dark out. Sometimes we have those little things called snowflakes going around, or glare or raindrops, and this will give you the best chance, the true custom laser, to be happy in all different lighting.
Well, we have just a few more minutes, and we hopefully have answered most of your questions. But again, just as a reiteration, if you have other questions that we don't get to tonight, because we're going to stop abruptly at 30 minutes, but I also want to let you know that after we're done, after Dr. Endel and I are done with our physical presentation, we do have Casey, who's one of our technicians, and others that will answer questions for you. So the chat box off to the side, just chat, put in your question. She'll try and answer them also. But the best way is, if you don't get your question answered, call us or come in or come to an open house. We're always available. So we really encourage the idea of knowledge and coming to see this. It's very disarming once you see it from start to finish. It's not as scary as you think. And part of 43,000 of these now, approaching 44,000. So I've seen a few of these, and I mean, I'm telling you, my friends, my neighbors, my relatives, his friends, neighbors, moms, Dr. Fichte's sons, Dr. Elmer's best friends, we've all had this because we believe in it. It's not something we're just we think is going to be here and then gone tomorrow. So one more question that I see here, it says, what happens during the consultation? What are some of the tests we do? And tell them some of the most amazing things that you'll ever have done to your eye during our tests.
Well, and we talked about, it's just very important to know the shape of the eye and what uniquely makes your eye healthy, and is it safe to have the dimensions that can withstand doing this laser from the surface. So we do a dilated exam. We're going to get all of your full glasses prescription, and we're going to look to the front and back and make sure the blood vessels in the retina, the film of the camera, are healthy. We're going to check the eye pressure. We're going to look to make sure the rest of the health under the microscope is in good shape. We're going to take about 4 different very complex mapping systems, one of just the rate of surface and the shape of the surface on the front of the eye. So accurate that it can tell me if there's an early form of a corneal thinning disease, or someone just stayed in their contacts a little bit too long. Another point we'll bring up, we like you before you come in for a full evaluation to be out of your contacts for at least a week.
Let me just interrupt you for one question, or one answer, or one quick point.
Yeah.
We have 2 things. We have a consultation. Right. You're here for a couple hours, maybe 2 or 3, or a screening. And somebody just said, are they the same? Definitely not. A screening means you come in, you meet with one of our professionals, we do a quick test of your eyes to see what kind of prescription range you are, to see if you're even in the ballpark. But to really qualify, you need the consultation that Dr. Endel's going to talk about.
And you need no preparation other than an interest for the screening.
Right.
For the actual consultation, that's the 2-hour exam. We really prefer, although not legally required, that you have a ride, because you're going to be dilated. We're going to shine a lot of lights in your eyes. And if you've ever been dilated, the eye doctor, your distance vision remains the same, but your up close looks a little bit more difficult for a couple of hours, and you might just not feel comfortable doing it. We don't want to start off our relationship with you having a fender bender, okay? But during that exam, we take these maps that really let us know that the shape looks settled down. We take measurements of the protein in your tear film to let us know if you look to be a higher risk for dry eye that we might want to treat ahead of time. We look from front to back to make sure the blood vessels and the rest of the health is in good shape. You see 2 different doctors on average, or at least 2 doctors will see your information, so that we're really in consultation to give what's the best recommendation that we feel based on your measurements to give you the most glasses independence.
We have just about a minute and a half left, but just as a reminder, after we're done until at least 7:15, they'll be available for questions. So if you have questions, go ahead and type in the chat box. In the last, say, minute and a half, or so, not to rush you, but talk a little bit about dry eye, because that always comes up. Do you get dry eye? Could you have dry eye? Dry eye. Go ahead, talk to me.
Well, first of all, most folks, especially in the Northeast, when those heaters come on, and if you're, my goodness, like we happen to be over age 40, you're probably a little drier than you used to be and have a little dry eye with no surgery at all. And dry eye doesn't have to be, boy, it feels like there's a tumbleweed going across the front of my eye. It can be that, boy, I'm reading for a bit and the words start to run together. As soon as I walk outside and I get one of those nice biting winds, my eye starts to tear. And you think, gee, that's not dry. It's wet.
Right.
It's tearing because it's dry and irritated. So there's many manifestations of dry eye, including a little blurry vision. Well, when we do a laser procedure, it temporarily, and anywhere from a couple weeks to a couple of months, decreases the eye's ability to sense that it's dry. So most people will be a little bit more dry for anywhere from a couple weeks to a couple months after the procedure. It does increase your eye's ability to make tears, and it's very unusual, less than 0.5%, for those nerves not to regain their ability to sense that dryness and make the tears as naturally as they did pre-operatively. So since we know this going in, we screen for it very in-depth, we pre-treat it if necessary, and we encourage you to use some artificial tears, usually a preservative-free type nature, and we write this down and give you samples of it in the first couple of weeks, if not months afterwards, just to get out of the gates the quickest. So very common stuff, but very treatable and hardly ever an obstacle for the patients.
Well, once again, we'd like to thank you because for taking the time out of your busy evening to sit and kind of chat with us a little bit. We do these routinely every couple months, and we invite you back if you didn't get all your answers to all your questions. But, contact us, 800-309-2020, info@fichte.com, or Erin Edson. She can answer questions for you. So thanks for taking the time. Other questions, like I say, they'll be around for a few more minutes, and feel free to chat away. Have a good night. Thank you.
Thanks for your time.